What's going on, everybody? Today we are talking all about hip impingement. This is something I've dealt with for a really long time, or I did deal with for a long time, probably about 5-6 years. It really kept me from squatting, deadlifting, just being as active as I would want to be in my life. You know, I would try to do these exercises, I try to do the right thing, I try to stay strong, or even just walk and get up from a chair. I just feel this pinch, this stabbing, whatever the heck it was within my hip joint, and it really just pissed me off. So let's just break this down today into a couple different sections. So I'm going to talk about what exactly is hip impingement, the different cases and directions that you should potentially go, and then we'll break it down into how I like to go about hip impingement, and it's a little different than the common ways that you would go after hip impingement that really just didn't seem to work for me and my body. And then we'll get into the exercise component. I'm going to try to give you at least 2 or 3 exercises that should really help you out. So we'll break that all down here in the video. So first things first, what is a hip impingement? There's all kinds of things out there on this. It's a pretty common issue that happens, but really it's where you get into these deeper ranges of hip flexion and you feel this pain, this pinch, this tension, pressure, something's kind of happening there. I find that this comes from, obviously there's labrum tears that are out there, right? So you tear some of the connective tissue within the joint, and then that, tissue can sometimes get stuck, and that will jam up the joint, and that can definitely cause some pain and discomfort, inflammation. If you have that, one, definitely go talk to your doctor, right? That's gonna be your first course of action. Talk to them, see if you need surgery. I will say the surgeries for hip impingement and labral tears is getting a lot better. They are improving that every single year, I find. But that said, if you would have asked me, and again 5-6 years ago when I was having this, if I would get surgery, hell no, I wouldn't have touched it, because just the results that were out there for people in pain and getting back to activities like squatting, deadlifting, running, sprinting, it really wasn't improving anything. If anything, it was kind of setting people even further back. So the labrum can heal. I had a labrum tear. I haven't had an MRI result since, but I don't have pain. So that said, I would say this is pretty healed up. It's pretty good now, and that's without surgery. So, but just get an idea of exactly what is causing your discomfort. So labrum tears, if that's happening, talk to your doctor, get an MRI, get some ideas of like the severity of that, and then make your decision on like, yeah, I'm gonna go the surgery route. I found a good surgeon, or I'm gonna try to go at this from a more conservative route with exercises, right? And that's what this whole video is just focused on, and kind of that route that I personally took. So I typically find that people who are having a hip impingement, this goes for the right side and left side, it's due to one or a combination of 3 things happening. So I made a YouTube short on this, and it seemed to blow up a little bit. So if you've come here from the short, thank you for supporting the channel. Like, subscribe, that stuff. But that said, we'll see that as people move, they start to just put a lot more pressure on one side versus the other. So we'll see that they'll either hike, and that hike then pushes this side down, and that can then start to create more, it closes down the space at that hip, right? So a lateral hike, as people squat, deadlift, walk, move, whatever it is that they're doing, that can decrease the space, which then causes more of that impingement. The second part is that we see that someone not only is height, but they're like laterally oriented over here. And that's obvious, right? You can see that space is closed down quite a bit. So then they try to, I can't really lift my leg here, but if you can imagine, I would try to lift that leg and I would run out of space really quickly. And then the third thing is being like anteriorly tilted and hiked over that side. So it's sort of like everything all at once. You're leaned over, you're hiked up, and you're sort of rotating and falling over, like this hip is going at a 45-degree angle over in front of me. That's all happening, and then I try to flex my hip, and I run out of that space, right? All of this is very exaggerated. I highly doubt anyone is walking around like this. Like, that'd be super weird. You would notice that pretty quickly. But that said, having some of that potentially happen during your movements. So this shows itself like if I squat down and I start to do this stuff, or I start to have some issues happening like that, that may be why you're feeling some of those symptoms. That's what it was for me. When I would go back and look at some of my squat videos, I would always be here, and then I would shift, at about 90-degree angle, and I think that was causing a lot of my discomfort and what actually potentially led to the tear in my hip. I don't know, maybe it was, maybe it wasn't. That's just kind of my journey and how I think about it. But that said, if you have all of this happening, well, it's like, what the hell do we do about it? How do we get out of this situation? How do we, tell our body that we don't want to shift, that we don't want to hike and do all of those things? Well, that's the number one question. I'm glad you're here. I'm glad you're sticking around with this video. I know it's getting a little bit long here, but it's very, very important because this is a common issue. So oftentimes, everything's over here, your body's shifting. What's causing that? It's often the opposite side hip pushing us over onto this side. It's easy to think like, oh, my hip hurts on this side, this is the problem. 90% of the time when I talk to people who have hip impingement, or really a lot of pain and discomfort, the area that is calling out and it's saying, I'm hurt, this is bad, something's wrong. We look at it as the enemy when in fact it is the victim in these circumstances. So this area that's hurt, it's screaming out for help. It's saying, oh my gosh, I'm doing so much work because I'm shifted over, I've run out of space, I don't know what to do. Imagine going to work and you're doing 80% of the workload while everyone's sitting in the break room just drinking coffee. You'd be pissed off. You're gonna go to your boss, you're gonna yell and scream and say, what the hell is happening here? That's the same thing that's happening on these hips that are a little bit, frustrated, impinged. They're doing too much, right? So think of it that way. So the opposite side hip often doesn't have mobility to load appropriately, so we shift away from that side in order to complete the movement. Your body doesn't wanna say no. It's never gonna say no to you in completing a movement task. It will find a way. It would rather complete the movement than do it perfect, if you want to look at it that way. It will slap some duct tape on there, it'll rub some dirt in it, it will get the job done for you, but we need to probably teach the other side of the body to load up more effectively in order to improve the symptoms that you're having and offload the side that you may be having pain on. So I hope this is all making sense. Again, this is my personal approach. This is what has worked for me and my clients. There's so many things out there. Give them a try, whatever the heck it is, but this is what's worked for me. So thinking of this as a principle, I'm shifting, I'm doing all this stuff on one side so much more and that I've run out of space. And now that I need to load this side, I need to stretch this side open actually, not stretch this one, I need to offload this one. If I can stretch this side, then I can become a bit more symmetrical in my movements, or even just get to the other side and load this up, and that can often reduce a lot of the symptoms. So we're gonna dive into the next part of this video, which is really just 2 or 3 exercises that I've used specifically to open up that left side and offload the right side. They've been really, really helpful for keeping my hips nice and healthy, as well as just getting my clients out of that hip impingement. So without further ado, let's get into the exercises and start doing this.
So the first exercise we're going to use is a twist on a figure 4 or piriformis stretch. We're going to take the principle that we just discussed about stretching and loading the opposite hip and try to create some space or some range of motion, some flexibility on that side. So all you're going to need is a towel. Here I'm using an Airex pad. You're going to lie on your back and then take whatever object you have and place it under your hip. Now, if I'm having hip impingement symptoms on, say, my right side, I want to make sure I'm stretching my left side out first. So I take the object, place it underneath the right side of my hip, the side with the symptoms, so that way I can stretch the opposite side. From here, you can probably see that this lifts me up just slightly on that side, so that way I get a little bit of an angle, and that then creates a really nice, simple, yet deep and effective stretch on that opposite side, or here, that left side. Now, you can stretch out both sides of your hips. You may need to watch out, especially if you have a very flared up hip impingement. You may not want to do this on the affected side in which you're like pulling that knee toward your chest, and just focus on stretching out that opposite side for a while and see if that helps to make some improvements. But in most circumstances, you would benefit from doing this on both sides. So you get into this position, hold that knee to your chest, nice and easy, feel that stretch, and then you're just gonna do this for 30, 60, heck, you can even do it for 2 minutes if you want. I don't believe you can do this too much, but hold it for this recommended time for 3 rounds, and then see if your hip pinch or your hip impingement feels any better. So now that we've created some space at the hips, we've stretched that opposite side out really well, and maybe even the affected side, we then want to find some control over this pelvis. So we're going to be using what is called a hook-lying low reach. So the whole purpose of this is to turn on the hamstrings in coordinating the movements of the pelvis. Again, if we're twisting, we're anteriorly tilting, we're doing these weird shifts over to one side, whenever you're squatting or deadlifting or just walking, well, we need to find some control over that because you're just kind of smashing on your joints right now. You're going to need a foam roller, a yoga block, and potentially some pillows. Here I'm going to be using another foam roller just to support my head. You're going to lay down flat on the floor, take a t-shirt, maybe a small towel, roll it up to go underneath the small of your back, so that lumbar spine area. Feet go onto the foam roller, yoga block between the legs. Again, you could use a ball, something like that. And then again, your head on the pillow, foam roller, whatever it is underneath there, just to support that cervical spine. So set up in this hook line position. You're going to press the arches of your feet down into the foam roller, feel some hamstrings turn on, maybe a gentle squeeze of the yoga block between the legs, and then you're going to perform some deep breathing. So you're going to fully exhale everything out, pause for 5 seconds, and then a gentle inhale through the nose. And think about breathing into your back. I like to imagine I'm laying in a hammock and I'm trying to expand my back into all of the fabric of that hammock. You'll then complete this for a total of 3 rounds of 5 breaths. And if you need a little additional help with this breathing, I have made a video on how to properly do this, which I will link down in the description and above right here. So again, we're utilizing those hamstrings to control that pelvis in case there's any twisting or anterior tilting that might be happening. And we'll now get into the next exercise. So we've now stretched out the hips, especially that opposite side. We've activated some muscles to get some control over this pelvis, so that way you're not smashing into that hip impingement type strategy you have going on. Now we want to stand you up and we want to load this somehow. So again, same principles apply here. We want to stretch out the opposite side hip. So to set up the hinge, it's going to be in an ipsilateral position. So you'll take a small foam roller, place it against the wall. If you only have a large foam roller, you can use that as well. It's not going to make a big difference. And then you're going to need some kind of dumbbell or kettlebell. You'll set up with the opposite side. So the side that is not painful. You'll place that side on the outside of the foam roller. So if my right hip is hurt, I'm going to use my left leg and have the weight in my left hand as well. I'm then going to focus on keeping my knee in alignment with my ankle, which the foam roller helps to do, as I then hinge backwards. So I'm going to let that weight go down my shin, and then I'm going to come back up. If this is too difficult and you're feeling your back, you may just benefit from hanging out in the bottom position just for an isometric hold. You could do that for 30 to 60 seconds. But for those that are doing well with this, you just simply go up and down for 3 sets of, say, 12 to 15 reps. Again, you would benefit from this on the affected side, the side that is giving you trouble as well. So feel free to work that side. But just know it may give you some symptoms, so you may need to just work the left side or the side that isn't giving you trouble for a little bit longer time, but before getting back to strengthening the hip impingement side. So I hope these exercises helped you. I hope that this was a comprehensive guide to get you out of that hip impingement. Again, I've dealt with this for so many years. It was such a pain in the butt. If this does help you guys out, please share this with someone that has a hip impingement, like and subscribe to the channel for more content, and I will see you guys in the next one.